As the first practitioner seeing patients with the new FibroCentriX care protocol for neuropathy and fibro-related symptoms in the northeastern United States, we're here today with Dr. Gardner at his fully integrated medical practice in upstate New York. Dr. Gardner, a short time ago, you and I had a video conference where we began to talk about this treatment protocol. As I recall, you were somewhat hesitant and maybe even a little skeptical.
Well, I was absolutely skeptical. I've been in practice for about 15 years, and I've seen patients with fibromyalgia, chronic fatigue, many other complex conditions, and what you're telling me sounded too good to be true.
So what caught your attention?
As a doctor, it's a privilege and quite satisfying to see patients become well. On the other hand, it's probably most distressing when you see a patient dealing with a host of debilitating conditions and you can't do anything about it.
So you've seen a number of patients, Doctor. Can you describe your experience thus far?
Well, I do have to say this, originally being so skeptical, I actually could not believe the results that we've been getting already. We've seen a number of patients already in the short time that we've been doing this protocol with outstanding results. We've had patients in their teens all the way up into their 70s so far.
Any of those patients happen to stand out?
There's actually one patient which I was extremely impressed with. She was a 20-year-old girl that came in here with a diagnosis of a condition that was a genetic issue that her whole family experiences. It's a connective tissue disorder. And when she came into our office, she was crying, she was upset, she didn't think that she would be able to enjoy a good life. At 20 years old, she was already defeated, which really bothered me because she's just starting life right now. So what we did is we titrated her with the solution, and within 7 minutes, this girl's life was completely different.
So backing up just for a moment, when she came through the door, you said she was emotionally really struggling. What were some of the things that were on her mind at that time?
Well, she didn't think in the future that she would have or be able to have children or have a husband and a normal life because this condition is so debilitating over time.
So after her initial visit, you see these patients back 3 to 5 days. What did you notice and or what did you talk about when you saw this patient on her initial follow-up visit?
Probably the thing that stood out to me the most was how much less emotional she was and how happy she was. She was actually smiling, and she told me she finally had some hope, which was great.
So I suspect many of the patients that you've seen or some of the patients within your practice that you've talked to about this maybe have felt skeptical as you had. Any experience with any of those thoughts or feelings from the patient side?
Well, I have to say that a lot of the patients, when they came in, were very skeptical about this due to the fact that all the treatments that they've tried so far have not been helpful to them. So they were thinking in their mind, just one more thing. But we did get them to come in here and told them that this was something different. And one of the biggest considerations for them was also cost. And what we do is we ask them how much they've been spending on their search for a solution. And the average person is spending well over $3,000 to $4,000 to $5,000 every year trying to find an answer to their problem. The good news for them with this is a fraction of that cost, and this actually works. And we've had outstanding results, as I said before, and the patients themselves have even asked if they could buy stock in the company.
Doctor, what might you say to a person out there that might be watching this, that's struggling and having symptoms and have conditions and have diagnoses and they feel like they have no hope right now?
The first thing I would say is there is hope, and I've seen it now using this protocol. Do not hesitate to come in. The consultation is at no charge, and we do that because we want you to get better. I have such a high belief in this protocol now that I feel everybody that has symptoms that wants to get better should be able to experience what we've experienced in our office in just such a short time.
And doctor, of the patients that you have seen, what percentage of the patients that you've seen that have gone through the testing phase have actually gotten better?
So far, it has been unequivocally 100%.
Every single patient?
Every single patient.
And out of those patients, how many felt at the beginning like there was no chance or felt real skeptical?
The same number, 100%.
Well, that's great. We're very happy with the work you're doing here in upstate New York. If you're out there listening, you happen to be in upstate New York, We've got a great practitioner in the area. If you're outside of this area and across the United States, if you'd like to make your way to the FibroFreedom.org website, we can send you more information and keep you apprised of when new practitioners come online and become available in your area. If you happen to be watching this video in an area whereby there's a form for you to fill out information with your name and your phone number and the various things, we're happy to either send you information or get you scheduled to see a practitioner in your area. Dr. Gardner, thanks so much for being here and a testament to a great example of a practitioner who's doing great things with patients who are really struggling.
It's my pleasure, Paul. Thank you.